Hello dear students, today we'll discuss a small topic that is clavipectoral fascia. So before we discuss the topic as such, we'll see a question that is clavipectoral fascia is pierced by or except A. acromiothoracic vessels, B. cephalic vein, C. medial pectoral nerve and D. lymphatics. So after the session, we'll have an idea about this answer. In this diagram, you can see the clavicle, the pectoralis major muscle, then the subclavius muscle, pectoralis minor muscle. So the clavipectoral fascia is located in the anterior wall of the axilla that is deep to the pectoralis major muscle. So this is the clavipectoral fascia. Or in other words, you can say the clavipectoral fascia is a strong sheet of fascia that extends or stretches from the pectoralis minor to the clavicle. So what is the extent of clavipectoral fascia? The vertical extent, superiorly it splits to enclose the subclavius muscle, and it is these two layers are getting attached to the inferior surface of the clavicle at the lips of subclavian groove. And these two layers unite to form the clavipectoral fascia, which is a strong sheet of fascia, and then it also encloses the pectoralis minor muscle. So after enclosing the pectoralis minor muscle, it becomes the suspensory ligament of axilla, which is continuous with the axillary fascia. So the clavipectoral fascia, it encloses two muscles, that is the subclavius and the pectoralis minor muscle. It also forms two ligaments. They are the costocoracoid ligament and the suspensory ligament of axilla. So we have already seen the suspensory ligament of axilla. The part of the clavipectoral fascia at the lower border of subclavius is thickened, that is extending from the first rib to the coracoid process, and this is known as the costocoracoid ligament. Now what is the horizontal extent of clavipectoral fascia? In this figure you can see the subclavius muscle, the first, second, third, fourth, fifth ribs. Now you can see the first intercostal space, second intercostal space, third and fourth intercostal spaces. This is coracoid process and this is a short head of biceps brachii. Now the horizontal extent, medially the clavipectoral fascia is attached to the first rib, which is medial to the subclavius muscle, and then it blends with the fascia covering the first and the second intercostal muscle. So this is the clavipectoral fascia. Now laterally it is attached to the coracoid process and to the fascia covering the short head of biceps brachii muscle. So in the vertical extent, it splits to enclose the subclavius muscle, then it forms a strong sheet of clavipectoral fascia, then it encloses the pectoralis minor muscle, then unites to form the suspensory ligament of axilla, which is attached to the axillary fascia. And horizontally you can see medially is attached to the first rib and the fascia covering the first and second intercostal spaces, whereas laterally it is attached to the coracoid process and the fascia covering the biceps brachii muscle. In this context, we will see what is infraclavicular space. That is a space formed by the splitting of two layers of clavipectoral fascia while it is enclosing the subclavius, and that is seen at the undersurface or the inferior surface of the clavicle. Whereas supraclavicular space is in at the upper surface of clavicle, where it is formed by the splitting of investing layer of deep cervical fascia. Now we will see what are the structures piercing the clavipectoral fascia. So you can see this is the clavipectoral fascia. You can see the subclavius, the pectoralis minor and the suspensory ligament of axilla. Now there are four structures that pierce the clavipectoral fascia. They are the cephalic vein and acromiothoracic vessels, or you can say the thoracoacromial vessels, the lateral pectoral nerve and the lymphatics. So it is usually remembered by the mnemonic CALL, C-A-L-L, that is C stands for cephalic vein, A for acromiothoracic vessels, L for lateral pectoral nerve and L for lymphatics. This figure you have to learn. You can see the clavicle, the subclavius muscle, then the pectoralis minor muscle, you can see the clavipectoral fascia, then the suspensory ligament of axilla. And you can see the structures that are piercing the clavipectoral fascia. They are the cephalic vein that is draining into the axillary vein, the thoracoacromial artery or the acromiothoracic artery, which is a branch of the axillary artery. Then the lateral pectoral nerve, which is a branch of the lateral cord of brachial plexus. Now you can see the medial pectoral nerve. The medial pectoral nerve is pierced in the pectoralis minor muscle, and it is not pierced in the clavipectoral fascia. Okay, so the lateral pectoral nerve is the one that is piercing the clavipectoral fascia. The thoracoacromial artery is divided into 4 branches, that is acromial, pectoral, deltoid and clavicular, either before piercing the clavipectoral fascia or after piercing the clavipectoral fascia, and the corresponding veins join with the cephalic vein. So they join usually before the cephalic vein pierces the clavipectoral fascia. So eventually the thoracoacromial veins may not pierce the clavipectoral fascia. So the answer for the question that we discussed initially is C, medial pectoral nerve, that is clavipectoral fascia is pierced by all except medial pectoral nerve. It is not medial pectoral nerve, it is lateral pectoral nerve. I hope this topic is clear for you. Thank you.